Allison, we're now streaming live.
Good evening, and we are back for another episode of COVID Conversations in Black and Brown. And we have a lineup today of some superstar females as we are going to talk about COVID and its effect on children. As we know, it's a time for back to school. And obviously, a lot of parents and caregivers are very apprehensive about sending kids back to school due to the risk of COVID. So, for example, we've seen at some college campuses that classes have actually been changed to completely virtual. For example, University of North Carolina, they recently canceled in-person classes due to the fact that coronavirus cases were going up in the dormitories and at a local fraternity house. Also at Notre Dame, 80 of 418 kids who were tested on Monday tested positive. And as a result, the next day, the school decided that for the next 2 weeks, undergrads will have to go virtual. Also, University of Kentucky and numerous other college campuses around the country have been dealing with the effects of students testing positive. And what are some of the deleterious effects of this? Well, a recent study just came out in the journal Pediatrics, which showed that in a group of 192 children, about 25% of them tested positive for COVID. And what was so interesting about this study is that they found that children who were asymptomatic were actually the ones that had the greater loads of virus. So I think that this is something that we have to look into further before we say, yes, these kids can just go back to school. And I'm so excited about today's panel that we have of esteemed educators and medical professionals to talk about this further. We have Jean Woods Powell, who's an educator as well as a parent. We also have Dr. Renee Poole, who is a family practitioner out in Southern California. We have Myra Sandoval, who's a social worker here in the Bronx. And last but not least, Dr. Nikki, also known as Dr. Nicole Grant, who's also a social worker here in New York City. So I'm going to start with turning it over to Dr. Renee Poole.
All right, well, thank you very much. Let's go ahead and get my slides up. And we'll have to allow me to share my slides.
Do you have access to share? Okay.
All right, here we go. So it's such an important topic, and so thank you for bringing us all together to share about this dilemma that a lot of parents are really dealing with right now because of the current situation that we're under with the pandemic. Whether or not to return to in-person school versus staying at home. And yes, there are pros and cons to all of this. The cons are pretty obvious. We don't really know what's going on with this pandemic. We are learning about the virus, how it behaves, its long-term effects, and we're seeing increased rise in our children. But there's also a lot of pros, which we'll also talk about more amongst our panelists. Our children have been out of school since March. School is a place where collective and socialization takes place. School is where they may be utilizing different resources. So there are pros and cons to this very important decision that parents are really struggling with and must consider multiple different factors, including the readiness of the school environment. Do they have processes, policies, and procedures in place to properly deal with it? Whether or not virtual learning is even an option. Virtual learning is not an option for everyone, unfortunately. And then whether or not your child is utilizing school-based resources, nutritional services, counseling services. You also have to consider the general health of your child. Your child may be at increased risk due to underlying medical conditions. And then in your local area, you must look at the infection rate. Across the country, it's different everywhere. And so in looking at all of these different factors, it's a tough decision. And the CDC does have a decision-making tool that I encourage all of you to look at, to kind of really look at all the different factors to make the best decision for you. It is an individual choice. And why is this a big deal right now? Before, when all of this started, it was really heavily focused on adults, the older adults with chronic medical conditions. But now we're starting to see a change. What's going on? You know, as of August 13th, we have over 460,000 children have tested positive for the coronavirus, 9% of the overall cases. And just in the last 2 weeks, that's been an increase of 24%. That's scary. And 1 of 3 of those who have tested positive actually require intensive care. And we're noticing, just based on the studies that are being done, that 42% of those children are at higher risk because they have an underlying medical condition. So considering all of these things, we must coexist with this virus and learn to reduce our risk. We must first and foremost make sure that our children's immunizations are up to date. Unfortunately, with the pandemic, with the shutdowns in many cities across the country, preventative care services have been put on hold and immunization rates have gone down tremendously. So please make sure that your children's immunizations are up to date. And the flu season is amongst us. Please make sure that the flu vaccine is also obtained. In the previous years, the flu season is getting worse and worse. So we want to protect our children in all ways. Instill in our children the importance of washing hands and using hand sanitizer. And this is a learned behavior. So adults, we must also lead by example and teach them and make sure that they know that. And adults, make sure that we're disinfecting the frequently touched areas and items to reduce the spread of infection. And this is something we need to be doing anyway, covering our cough and our sneezes, not just with COVID, but in general. Now, of course, it is encouraged to wear a face covering. And you know, our children, our youth love to share. We teach them to share. But right now is not a good time for that. They're sharing their cups, their food, their drinks, even makeup in our older children. But sharing such items increase the risk of this virus. And if anything that is possible, social distance, staying at least 6 feet apart to reduce the risk as well. But it's difficult in a school environment, which is why so many parents are struggling with the decision on whether or not to have their children return. Stay home when you are sick. Oftentimes, I remember growing up, if I was sick, I still went to school. If I was able to get out of bed, I still went to school. We can't do that anymore. We must stay home to protect ourselves and others. And then we must also avoid sick people as well. And then if you are suspicious of any symptoms, have been exposed, just don't feel well, are concerned, get tested. Oftentimes we're afraid to get screened because of the unknown. We don't want to know what's going on. But this is the time where we actually want to know to protect ourselves and others. And we all have heard the rumblings about a vaccine. A vaccine is far away. There are clinical trials that are undergoing right now, but unfortunately, we have a long ways to go. And those clinical trials, unfortunately, are only being done on adults right now. And in minority communities, the numbers are very low. So we don't even know how this vaccine is going to work and operate for our children. So what we're seeing as far as symptoms, just a reminder, very similar to adults, but with our children, we want to be particularly careful with difficulty in breathing, unexplained fatigue, a rapidly progressing rash, and even GI symptoms such as vomiting and diarrhea. It is good news that early data shows that our children are less likely to get infected. So far, only 9% have been positive, and they're less likely to have severe illness. And just as mentioned, many don't even have any symptoms at all. We do need to be aware of those that are high risk, similar to how adults with certain medical conditions and certain groups are at high risk, children just the same. Those that are intellectually and developmentally disabled are at higher risk. Children living in households with adults with chronic illnesses and essential workers, high risk. high points of contact. The more contact they are, the higher risk sheer numbers. And then unfortunately, we are seeing our Black children are 5 times at risk of being hospitalized for COVID, and our Latinx children are 8 times the risk of being hospitalized compared to their white counterparts. Now, something else I want to just share so everyone is aware of what we're also seeing. Though it is rare, we want you to look out for this just in case. We're noticing that children who have had a previous COVID infection have resolved and are well, but then all of a sudden develop this multi-system inflammatory syndrome. Now, this is very rare, so it is something that we don't see often, but it is something to be aware of. So it affects at least 4 organ systems, and the child will present with high fevers, a rash all over their body, conjunctivitis or pink eye, other symptoms such as a beet red tongue and dry and red cracked lips. They don't seem like themselves, they're not eating, they're tired, fatigued, nausea, vomiting, they look ill. And so it's very important that you do communicate with your doctor if you're noticing your child with these symptoms. Oftentimes, most times, these children do need hospitalization. So in all of this, to just kind of set the tone for our discussion today, we must stay informed. Things are constantly changing, and we are still learning a lot with COVID and how it behaves, how it looks, the long-term complications. We must be proactive and take necessary protective measures. And then we must use all of this knowledge to protect ourselves and our children, not only physically, but also mentally and emotionally. And so I look forward to the rest of our discussion with the rest of the panelists. Thank you.
Thank you, Rennie. That was very interesting and enlightening. I'd just like to go to Jean right now. Could you tell us a little bit more about your COVID-19 story? I know that you were infected, so could you tell us basically what went down?
Hi, everyone. Good evening. My name is Jean Woods Powell. I'm an educator. So with that being said, this is probably my first time really talking about my experience. It was pretty, it wasn't as severe as I know so many have suffered, unfortunately, but I will share. So I actually live with my dad. Being in a school also put me at risk, but I live with my father, who actually started showing symptoms 5 days before I did. With that being said, on that Monday, March 30th, my dad started showing, had a really high fever. He's 70 years old. So you can imagine, you know, just how I felt, you know, when his fever had tipped at that Monday, March 30th, 103. And then the next couple of days, he just could not break the fever. I mean, we tried everything, Tylenol, you know, cold rags. We tried everything for my dad. And then that Friday, I started running a fever. And I remember I was in a staff meeting and I started just like feeling, you know, worse and worse. And my main thought was like, okay, whatever he has, I now have. And hearing just all the symptoms that were being said, you know, the fever, the loss of taste, just the high fever that just would not break no matter what we did. I knew that we probably had it. I think many of us can also, those that live in New York, in that March and April time, you knew that there really wasn't much options. So with us running a fever, we knew that our local hospital was overwhelmed. And when we actually called, because at that point, his fever spiked to 104, and mind you, he's 70 years old. I called and they said, is he in respiratory distress? And I said, no. They said, well, he can't come here. And so with that being said, I knew that Sunday, being that he now was almost at day 7 with 104 fever, I said, we have to go to an urgent care. So we went to an urgent care and they actually diagnosed him with pneumonia. And obviously linked to what we now suspect is COVID. And once again, because we didn't have respiratory distress, we knew that we couldn't get to a hospital. And our nearest hospital had so many fatalities, they were on the news. So we knew that we just couldn't go there. After about 3 weeks of self-treatment, which I can also say as an educator, that's what I heard across the board, was that my team, my faculty, students and families, everyone just engaged in self-treatment at that point. And March and April is about self-treatment. Going to a hospital was not the ideal situation at that point. That some of that was just said in our communities. Try to duke it out at home. And we did the turmeric, the Tylenol, the honey, the lemon, the vitamin C. I mean, we did everything we could to self-treat. And after 4 weeks, both my dad and I were fine. Yes, now I do have the antibodies, so I know I did have it. I couldn't get a test at that point either. Even my dad going to urgent care, there was no test available for him to get to find out if he had COVID. And once again, as an educator, I heard the same story over and over again. We were turned away from the hospital. The hospital, you know, unfortunately, we incurred a lot of deaths. Those that did go to the hospital, they were put in a ventilator. And from my school community, they did not survive. And these are parents, these are uncles.
What happened?
So with that being said, it was, you know, even though we both survived, and I'm grateful for that,
It was?
that the devastation is really unparalleled.
Wait, I can't hear you. Take off that mask.
Sorry about that, Jane. Could you continue?
So with that being said, I mean, I'm glad I had the floor to share that experience. And you know, as Dr. Renee indicated, it really was a lot of preventative care that we had to put in place in our communities because of especially during that time, the lack of access to medical treatment, medical care. Even as an educator, going back to that, we had to really engage in much wraparound on our own. So I know that as a administrator, I had to make sure that my parents, even school community, were getting access to medical services. We had to engage in counseling. I know Dr. Nikki will talk about the social work piece and mental health piece, bereavement services, unemployment services. I think you all know during that time, there's a lot of layoffs as well. And just really even down to food, we really had to make sure that we had deep connection with food bank. Because it wasn't just a medical situation during the COVID outbreak. I mean, even now it's still happening, but it was really, it came down to life and death. Basic needs weren't being met during that time with everything shut down. So we had to really consider the wraparound piece.
Okay, thank you, Jane, for sharing your story. It's I think a lot of people can relate that it's very common. Like it's very common, like what you went through, trying the turmeric and everything else, and not really being able to get tested. And you are an adult. So this question I have is for Dr. Renee. Dr. Renee, can you tell us how COVID-19 presents in children? Because for Jean, as an adult, she presented with the symptoms, but kids don't necessarily present with the symptoms. So what can parents do to know that their children have COVID and how to protect other individuals in the household?
Absolutely. So, oftentimes there are no symptoms, which is the scary part, right? So outside of that possibility, if there's a fever that is unexplained, now we cannot ignore it. Usually prior to this pandemic, we would give Tylenol, ibuprofen, do a watch, wait and see. Now that is not the case because it could spiral very quickly into complications related to COVID. And so a fever, an unexplained fever, is very key as far as symptoms. And then also the coughing, the shortness of breath. But we're seeing a lot of GI symptoms with the children, with the diarrhea and the vomiting. And something very different compared to adults is this rash. this inflammatory vasculitis that we're seeing with the children. And so all of the preventative measures, unfortunately, and I always say these are things we should be doing anyway, but I think we've oftentimes taken things for granted and been very lax. So this pandemic has really reminded us the importance of just the basic things as washing our hands and not touching our face. The virus enters the body, any infection enters the body via the eyes, nose, and mouth. And so if we're not touching our face, that reduces the risk. If we're covering our cough and our sneezes, as we're coughing and sneezing, of course, respiratory droplets are being sprayed. That reduces the risk of spread. And now, of course, in many counties across the country, there are face mask mandates. And those over the age of 2 are encouraged to be masked, to protect themselves. So these are very easy interventions that can be made. It does become very difficult when you're in the household with adults who may be older, who may have other chronic medical conditions, or it may be difficult to socially isolate. You can't really socially isolate a child, unlike adults. And so that creates a very unique situation for households if someone were to get sick. And our children are not really understanding and truly understanding the depth of what's going on with social distancing. And it's really impacting their emotional and mental well-being. They're really going through a lot. So we just also need to be aware of the mental emotional impact of all of this too. And so watching for signs of anxiety, for frustration, talking to your child, making sure that they're talking about their feelings is another way to kind of help reduce the risk of complications potentially related to this pandemic.
Okay, thank you for that. And we talk a lot about, the younger children, going back to school, and the parents are so worried about going back to school. And this question is for Dr. Nikki. Like, a lot of college students are going back to school. And as Dr. Myers mentioned at the start of the webinar, that a lot of schools are having to close back on, opening, on reopening the doors. And as we could see that there's a lot of racial and economic disparities that's going on with, not only college students, but students, like children cannot, not everybody could tutor their children at home. Not everybody has access to being online. So Dr. Nikki, what are universities and colleges doing right now to offer support? And especially for racial and ethnic minority students, especially international students, how can they get access to these resources if they're unable to go on campus?
Hi, can you hear me? I can't speak for every university, but I'll start with the university that I work with, which is Hunter College. And I think since the start of the pandemic, Hunter did an excellent job in trying to get in front of this whole remote learning. And so what we did was we tried to make it as comfortable as possible for students. One of the things was the school tried to do their best to provide laptops for people who may not have, or some of our students lack the resources. Some of our students are living in situations where they can't get on Zoom because of they're living in quarters where there's no privacy. And in social work, a lot of times we're talking about things that are very personal and very private. So I think that the schools are very much aware, or at least Hunter was very much aware of this. And we tried to make the students, as comfortable as possible, being so that we were able to be more accessible to them. So professors were available. We were giving our cell phone numbers. We were providing the resources, in that we were tapping into the provider agencies for people who may not have food, or our students who may not have shelter. A lot of our students are in homeless shelters, or they're living coupled up with multiple people. So it was up to the school to, as social workers, we're used to dealing with crisis. We're used to dealing with social phenomena, and this was a major crisis. So I think that what we did was we allowed the students also room to vent and talk about, hey, the breadwinner in my house is now sick and dying. And I'm supposed to sit in this 2-hour class. I ran a class on PTSD and COVID and the aftermath of COVID. And so we spent the whole summer talking about what does COVID look like after we get across this pandemic. Right now we're in the thick of it, but what does it look like afterwards? And before we could even talk about that, I had to give these students room to cry, to talk about, I'm afraid, to talk about, I don't know what tomorrow's going to look like because I lost my job. Social work students lost their field placements, and without their field placements, they can't sit and take their tests. So the school as a whole, we got together and we started doing breakout groups to where we could talk about, okay, how can we deal with this? How can we help our students? And that's still going on, not just for the students who live here, but the students internationally, because of course, we still have a responsibility to them too. So we are pooling our resources, not just from professors, but from our contract agencies that we work along with every day. As far as the racial disparities, again, I couldn't start my class without talking about George Floyd. I couldn't start my class without talking about how students are feeling. I had a class where I had 2 Black men that just started crying, saying that I'm scared. I don't know what's going to happen to me. I feel like if I walk out of my house, I'm a target. And so we can't begin to start a class on cognitive behavioral therapy without first talking about, hey, what's going on right now? And what's going on right now is the systemic racism that we see every day and the racial disparities, which we even saw with the masks. You had some populations where the police were handing out masks, and you had some neighborhoods where police were arresting people because they didn't have a mask or they were about to put their mask on. So I think the social work schools are doing what we've done for years. We're getting in front of the situation, we're talking about it, we're calling a thing, and we're daily looking at how we can support our students.
I just want to chime in real quick and just say that we see these health disparities with COVID, and let us all be clear that is the root cause of this is systemic racism. That is it, okay? And it's so complicated, it's so multi-layered, and COVID has just highlighted and really pulled that Band-Aid off this old wound that we've been trying to heal. And it's so important that we deal with all of this in that way, physically, emotionally, socially, all these different aspects, because it's so complicated and we're all impacted in so many different ways.
And I must say, teaching at in CUNY, I'm very proud of the students because I have Caucasian students who are able to say, I am privileged. And COVID showed me that I'm privileged even the more, and what that looks like to my counterparts who don't understand what privilege is and don't have the luxury of the privilege that I have. So this is a time when we really see where we can have those conversations and our students can come to the table and really talk about, their feelings, their biases, and how it plays out in the workplace, in their lives, and the work that we're doing with our clients.
Thank you for that. And that is so true. There is a lot that's going on that's just like, once again, the opening of school is all about racial and economic disparities. The only people who might be able to send these children to school or have to send their children to school are Black and brown individuals, or low socioeconomic status individuals, and not sometimes the very white people who could sit at their home and tutor their children. And so this question is for Myra. As we spoke about earlier, a lot of the disparities that we're seeing are in the Black and brown communities, the immigrant communities. So what can local governments, school officials, and others in authority do to minimize the disparities associated with returning to school?
Well, something that I did want to say prior to until I get into that conversation is Dr. Nikki said something that just triggers something in me. And I also work with children as well. I'm a social worker, but my children are children. I work for an elementary school. And something that we've been working on is just different resources. Prior to the pandemic really happening in March, we were making sure that kids had access to computers. Now, my population is children in temporary housing. So it's children that are in shelters. It's also children that are in double up. Those children that are in shelters did not have Wi-Fi access. So now let's talk about the disparity. Now they're falling behind academically, emotionally, they're suffering because they're not with their friends. Some of them didn't have resources for food. So it was a lot of different things that were just combining, and it was challenging, trying to figure out how can you help the families try to overcome this, but more so adapt to this new reality. And it was scary for a lot of parents. It was challenging. It was something that as a school community, we had to just figure out, okay, so this family, let's see if there's a computer that has access already built in it with Wi-Fi. So that was something that we were working on. And then just possibly processing everything that has been going on. I feel that as school officials, as what can be done, safety comes first. So I know that it's challenging for so many parents, especially in our communities, just having to go back to work and relying on the childcare, having to, decide, okay, can I keep my child at home remotely, or what's going to happen with the income? And I feel like more services need to be given to these families. We need to implement, whether that's a stimulus check primarily for them because they need it, or any form of assistance that they need, whether that's being financial, emotional, definitely, but definitely being able to help them and being able to process their feelings, not only for their children, but for the parents as well. Kids are very resilient. I feel like the population that I work with, they're able to express themselves in so many different ways, whether that's verbally or that's, through dance or singing. But I also feel like the parents need that additional support. And that's something that my school and myself have been like working on implementing. We also did a town hall meeting, which I appreciate that you guys brought up as far as the systemic racism, because you have to address it all. It's just not one layered. It's a lot of different things that are affecting us. And, we need to stick together and overcome this united.
Indeed, united we stand, divided we fall. I think that's the line that's often been said.
Yes.
And that question is for Jean. Like, we talk all the time about children and parents who, they're afraid to, send their children to school, or the parents are extremely worried. Everyone, is anxious, and that's quite understandable. But a lot of the times, who's left out of this conversation is the teachers. And I see so many things online with teachers saying that they have to buy their own supplies. Some teachers are putting in their wheels, and it's scary for teachers. So Jean, what steps are governments and local officials and school administrators taking, not only to protect students, but teachers and other professors as well?
I'm going to answer it twofold. I'm going to start with what I started this summer. I know I spoke to a few of my just constituents about it. So in June, I called a community mapping meeting. And with that being said, it included my local just organization, CBOs. It included other school leaders. It included even some of the, our local just government officials. And in that meeting, we really looked at, we're now really interconnected in the face of COVID. And it's everyone's responsibility to put their hand to the plow and provide services. So our local universities now is looking into how they can provide interns to support the academic piece with tutoring students. Of course, they're going to go through the process of fingerprinting and just making sure that everything is documentation is correct. We have obviously our food banks now, multiple food banks that are providing breakfast, lunch, and dinner for families. Because guess what? Those, Maslow's needs that need to be met. We can't even talk about education or being able to work if no one's eating. We talked about just counseling services, and once again, CBOs that will provide counseling for our families, no matter if they don't have, no matter their immigration status. We talked about just even when you talk about wraparound care and who's going to be providing the after school care in light of just school budgets being slashed. So we talked about that with our CBOs, who's going to be available when, and understanding that now school schedules are short. We know that with COVID and now with lunch not being separate, lunch is now in the classroom, schools have shorter schedules. That's going to impact parents that are working. So yes, of course, on the district level, we're getting all the information about protocol, health and safety. We're getting, in terms of just PPE equipment, temperature checks, they're talking about just what do you do in terms of tracing, from the classroom to the building structures, they're talking about the health and safety piece. But one thing I do want to mention that Dr. Nikki and Maya did speak about is that our teachers need to be trained and supported, because there's going to be a lot of trauma coming in. And we know that, once again, the mental health piece cannot be neglected in this conversation. Yes, we're talking about health and the physical implications of COVID, but our kids and even our teachers and staff are coming in with trauma. And how are we dealing with that? How are we first, obviously, training our staff to support on a social emotional level our students and our families, right? How are we now even thinking about our staff members that are hurting and suffering, right? And how are we implementing workshops and small groups and support for our teachers? Because guess what? They can't pour from an empty cup. So that's something that we have to address. And once again, we know that the districts are providing protocols. They're telling us what to do in terms of health and safety, instruction, what's that called? Blended learning. But we need to think about the whole entire piece, the mental health, right? We need to talk about, obviously, what we do in the face of COVID diagnoses, and how can we make sure, which we know DOH gives, is supporting with just access as we know it. And we know that parents have to really, and even like I said, teachers, their access to medical care as well. So with that being said, we really have to engage in training for our teachers and educate and support them on every level. And even engaging in their own self-care during this time.
Great. Thank you so much, Jean. We have a question from the chat, and I'm going to direct this to Dr. Renee because it's a medical question. One of our viewers says, how much emphasis should be placed on having a child tested who is only exhibiting one of the many potential symptoms, such as diarrhea?
At this point, I strongly encourage testing. If there is any question, any thought of the possibility based on the symptoms, based on potential exposures, find out, and get tested. Because one, we have the knowledge and the information, and that itself is empowering, so we can implement certain preventative and interventional measures. But then also, for a public health concern, we have to make sure that there is testing. And I know in the beginning, all of this, oftentimes we would have symptoms and we were turned away. We were told to stay home. And unless you have certain severe symptoms, then go to the hospital. And therefore, we had a lot of individuals who were not being tested. Testing supplies weren't available. Now it has gotten better. It is not universal across the board. We know this, but at least we're moving in the right direction where testing will become hopefully more universal and more readily available, just like a flu test. So, if there's any thought, just go ahead and get screened, because I'm also thinking about if the child has symptoms, I'm thinking about the parent or the grandparent or the teacher or, anyone else that child might be in contact with who might have a higher risk for complications. They may be exposed and, unfortunately have a dire consequence. So testing is key. Testing is knowledge once you have the results, and then you'll know what to do.
Thank you. I want to go back to talk about the mental health piece because Dr. Nikki, Myra, and Jean, they all touched on the mental health, and mental health is such something that's very, very, big. And I know I have my nieces and my nephews who are excited to go back to school, but unfortunately they cannot go back to school, and the children miss, spending time with their friends. They miss interacting with their friends. I know one of my nephews, he's very, sad about the fact that, he cannot talk to his friends. So what conversation can the parents have with the children as to okay, sweetie, I know you want to go back to school, but you just kind of go back to school now. I know you miss your friends, but you just kind of go back to school now. So what, any tips on how to start that conversation, or what to have during this conversation, or what to say during this conversation, sorry.
I would say kids are people too. We have to talk to our children. I think that when the pandemic first hit, we were so into making sure that everything was okay and everybody was okay, and we get everything the way we need it to be. And we lost the children in that. School stopped. And then here we get this iPad and this computer. And no one said, you're not going to see your teacher again. No one said you're not going to see your good best buddy again. No one said you're not going to go to the sports again. We didn't really have these conversations because the adults were so busy doing the adulting. And we didn't have time for the children. And I think that what we need to do is start talking to our children, and listening to them. Ask them. Dr. Poole told us we have to let these children tap into the depression, tap into the feelings and the emotions. How are our children feeling? Check in with them. Ask them. How do you feel about this? Do you understand what COVID is? Do you know why we're wearing masks? And be practical and real with the children. Tell them, here's what I know, and here's what I don't know. And it's okay. And I think that I'll let Myra jump in, but I think that it's very important that parents need to know that we don't have to have all of the answers, but we do need to have conversations with our children. And if you're having a hard time having these conversations, listen, I'm not about reinventing the wheel if we don't have to. I love Sesame Street. You know why I love Sesame Street? Because Sesame Street attacks the adult topics on a child's level. So you tap into Sesame Street, tap into PBS, tap into some of these books where kids like pictures. Pictures tell stories, and then you can have conversations. But I think that we need to let our children know that you're safe, and we're going to do our best to maintain our safety, and we're going to try our best to get through this. I'll turn it over to you, Myra, if you want to add anything else.
Yes. So as Dr. Nikki said, kids, they're very resilient, and having an open conversation, being honest with them. Kids are also very observant. So they pick up on things that sometimes adults feel that they may be hiding from them, but they actually know and are aware. Something that I did want to say is that there's a lot of resources on schools.nyc.gov. There's a lot of social emotional learning topics, whether that's coping with anxiety or how to talk to your kids about COVID. So there are resources out there. And also YouTube. I mean, I go to YouTube for everything. YouTube is great as far as when it comes to just, if you're nervous as a parent, how to speak to your kids. There's also free resources out there as well that, like myself, I'm willing to talk to children, well, at my school, but, there are different organizations that do help and they are able to communicate on that need that kids do deserve, because it is a transition for them. It is a change. They haven't been with their friends. Some kids, have a difficult time, whether that's, because of their learning or, depending on their ability to just interact. My younger brother is autistic. So for him, it has set him back tremendously. So I've been working with him, trying to explain to what's happening and, processing everything that's going on. But it's something that kids and, individuals that do have challenges just need to adapt to. And there are resources out there that, are for the parents and are for the educators as well. I feel like the more we know, the better, and safety first.
I want to chime in real quick and get some input from Myra and Dr. Nikki. Something that we have not touched on yet, but want to just make sure that it is stated, is that not everyone's home is a safe home. And so this pandemic, of course, has forced everyone to stay home, right? To social isolate. But oftentimes work and school is a refuge.
Mhm.
Okay, and that's something else that we need to be aware of when it comes to the state of opening up our schools again as well. And what are we doing for these children who are not safe at home?
You know, and that's very challenging. You have people, like when we think about domestic violence, you know, we have Safe Horizons and Sanctuary for Families and those type of agencies that I'm sure are working overtime to try to combat that. But it's real. COVID has forced people to shelter in place, and that means you're sheltering with your batterer, you know, or and if people are frustrated over COVID, took a lot from people. It took people's lives. It took their livelihood, you know, and so that brings about a lot of frustration. And sometimes you have the batterer who may be abusive to their partner, and then the frustration, you know, heightens, and now you have that child. So I think that in this situation, we all need to become a community, and we all need to look out for these children. And if I can borrow the slogan from "See something, say something," we need to do that. You know, it's not enough to just say, "Well, that's what's going on in that house," but the children no longer have the refuge of being in the school. The teacher is not there to oversee. The after-school teacher is not there. These children are in the homes and behind closed doors all day, and we don't know what's going on. So now is the time to depend on the neighbors. Now is the time to depend on the people in the corner store, or the people who have access to these children. And now is the time for us to, you know, probably make phone calls and do well checks. It's okay to call ACS to just say, "Hey, I'm concerned about this individual. Can you do a well check?" And they'll do it. It's not, "Hey, I'm calling ACS so that they can snatch your child." But I think that in COVID, we have to be aware that everybody is not okay. You know, it's not just about staying alive, you know, because of the disease, but it's what the disease is bringing into the home, and that's a lot of stress. And stress makes people do a lot of crazy things at times, and stress causes us our coping levels, you know, to fall apart. So we definitely need to be more of a community when we're looking into how we are keeping our most vulnerable population safe, which is our children. And thank you for bringing that up.
I agree completely with Dr. Nikki. Something that I just wanted to say is that when I was providing counseling during, like, when school was in session, a lot of the kids were timid with having virtual counseling because they didn't feel that they had their own privacy. You know, having that own space, having my office and being able to provide one-on-one therapy to them was just their space, that time that they can say whatever they want. You know, they wouldn't get in trouble with me. So now with the whole pandemic and COVID happening, it limit the conversation. So I think it's important for us to just bring it back, and again reassure them that this is a safe space for them to express themselves. And as Dr. Nikki said, ACS does well checks, so that's definitely something that, you know, if you are concerned, if, you know, there's a family, if there's a friend or someone that you just have any, you know, speculations that something may be happening, they absolutely do that. So I think that that was really good that she brought it up.
That was a great question, and I think you guys answered it quite well. We have one other question for the chat. Again, it's another medical question, so I will pose this to Dr. Poole. What about the delay in receiving test results that interventions may be effective? I think it's a very good point because a lot of people are waiting a week before they hear back if their test is positive. So if you can comment on that, Dr. Poole, we'd appreciate it.
Yeah, that's the tricky part, and it's so unfortunate. I mean, the rate at which the results return is lab dependent. And once again, we're dealing with disparities here. So as we're developing testing, different labs and different ways in which the test is given, et cetera, we have different turnaround times. And so the instructions are, and we encourage you to do so, is if you are waiting for a test, assume you are positive until that test comes back negative. So assuming you are positive means you are social isolating yourself, you're quarantining yourself to reduce the risk of spread of anyone else. And all of those things that we have recommended for precautionary measures are things you need to still also continue to help prevent the spread to others. But it does create an issue for those who are working, and rely on that income, who are hourly workers, are not salaried or don't have the vacation time, don't have the sick time. They're at risk for losing their jobs. At times, it's so unpredictable as far as how long that test result comes back, but we must have you assume that it's positive until otherwise noted. And I'm hoping that in the future, we do have some standardization. We have more rapid testing available. That's not something that's universally available. It's popping up in certain areas, but those results you get instantaneously, just like a rapid flu test. And then hopefully we have laboratories who have accurate results in a quicker turnaround for everybody.
Thank you for that. Fortunately, we only have like 10 minutes, and this is such a good conversation. So I have like 2 more questions. The first question is for Jean, and I think anybody could chime in, but it's basically asking, how can we advocate for, or how can parents advocate for the children, especially now? And early, Dr. Nikki and Myra spoke about, domestic violence. Like, what if the school says, I want, like, everybody should come back to school, and a parent wants to be like, no, child to school. So what can the parents do to advocate for?
Okay, I'm unmuted. Hi. So with that being said, there are family and community empowerment teams in every district. So they're called FACE, the acronym. And their responsibility is to advocate for families, no matter their immigration status or they're in the shelter system. So that's one avenue. Well, I would say a second avenue for parents to have access to for advocation for their children. But first and foremost, there needs to be clear communication within the school, right? We know that communication is key within the school leadership, teachers. Then there has to be access. We talk about translation services, which we know that most school entities have, especially the Department of Education, they have that access for all parents to have, to be able to access translators to articulate and communicate, because we know that parents are the first advocates for their children. They know exactly what their children need, and they need the space and the floor to do so, no matter, once again, they don't speak English or their economic status. Don't forget your community education council, your CECs. I wanted to also add what Myra said earlier about schools.nyc.gov. Right now, every district is having family and parent meetings. These meetings are not just academic, they are about the social emotional piece. How can I support my child at home? How do I have these conversations about COVID? And even, getting children prepared for the start of school next month. So there's so many ways that parents can advocate. First, starting in the school needs to be open communication. And they, once again, they do have access, as we know. And then also as they move through the district, the FACE teams, the CECs, and also your CBOs that have many parent advocates. I wanted to also go back to what was said earlier about just this being a space for change and doing things a little differently, in a sense that we can't forget the shelter, students in shelters. So with that being said, I know for a fact that there has been such a push now, because there's so many, there's tens of thousands of young people in shelters. So with that being said, there has been so much movement now to ensure that they have access to technology, to Wi-Fi, that there's groups that are in place. I actually was in a meeting 3 weeks ago actually, to just make sure that we're moving in that direction in terms of supporting shelter students and children, and how are we ensuring that they have access to medical care. There's now going to be doctors going into shelters and really doing a lot of work. I once again, a DOE with the Wi-Fi, computers, and just making sure that they don't have any more barriers to education. So with that being said, we really have to leverage, and parents have to have every leverage within the school building and outside to make sure that they advocate for their young people.
One of the things that I would love to see the mayor and the Department of Education do is, I know that there are social workers within the DOE, but I think that especially now with everything that's going on with this pandemic and children going back to school, not going back to school, hybrid, whatever the situation, or totally remote, what have you, if they would have social workers and mental health professionals at the table, if they would give us a seat at the table to have these conversations, because post-COVID, we're going to see a lot of behaviors. You know, there's a lot of death and dying that's going on. There's a lot of separations going on. There's a lot of behavioral problems that we're going to see post-COVID. And I think that the DOE really needs to think about, you know, tapping into social workers and mental health professionals and seeing what can be done when these children do come back, because they're not, no one is coming back the same. So I think that needs to be addressed, and that's something that I'm really not seeing.
Okay, thank you for that, Dr. Nikki. We have 5 minutes, and I just want to end before Dr. Myers shuts down everything. I just want to ask each and every one of you, like, what advice would you give to parents now as they have to make the decision as to whether or not to send their child to school?
Can you repeat the question? Because we had some.
Sorry, it's what advice would you give to parents now as they have to make the decision as to whether or not to send the child to school?
I think that I'm speaking as a parent. I have a 7-year-old and I have a 16-year-old, and I think that I made the decision for the 7-year-old only because I just don't think that 7-year-olds are going to socially distance. I think that if I send her to school with a princess mask, she's going to come back home with a Scooby-Doo mask. The kids share and they swap, and so that I need to keep her home. But the 16-year-old, I gave him the choice because I think that he's, you know, old enough to understand what's going on, and we were able to talk about it and see what he was comfortable with and what I was comfortable with. So I just think it's an individual choice, and I think if parents can't make that choice on their own, then they need to talk to their family members or people who they respect, you know, or other professionals who can give them some more information. I am a big fan of the pediatricians. So I say, if nothing else, go to the pediatrician, talk to them first and let them guide you. So that's my 2 cents.
I totally agree with Dr. Nikki. It's an individual and informed decision. I actually spoke to my youngest son's pediatrician last week, so you beat me to that, Nikki, to really make the decision, or to, I guess, confirm the decision that I made in terms of my own young person, my own youngest son. And what I mean by informed is, you know, once again, speaking to the pediatricians, really understanding what's happening in the school level, meaning we talked about a lot about health and safety, asking that administrator, that principal, the teachers, what is going to take place when my child goes back to school. You know, are they going to be checked for temperature? You know, what are the safety measures with eating lunch? So really getting a lot of information. I think parents, there's so much power, right, in knowledge. You know, we see that a lot of confusion comes from lack of knowledge, lack of communication. And so I think that parents, you know, just be empowered to really do your homework, you know, really understand who your child, what their needs are, but also look and be informed about on the school level, the district level, what is happening and what is taking place to ensure that safety, health, and education. Let's not talk about that. Let's not leave that out. How will that school bridge the gap for my child as they now are picking up the pieces of so much loss of learning that took place during last year. So these are conversations that, you know, I would just really challenge parents, and even myself as a mother of 2 boys, to really be informed and be empowered in your individual decision.
And I echo all of that. It's an individual informed decision, absolutely. And I'll just add also, not just your pediatrician, but your family physician as well. So both pediatricians and family physicians take care of children. But not only when it comes to a decision with regards to returning in person to school, I just want to remind everyone to also make sure that you're still taking care of your individual health outside of COVID. A lot of preventative services have been delayed. A lot of medical problems have been neglected. Poor eating habits, you're not as physically active, etc. Please make sure that you are taking care of your individual health, your preventative services while you are still dealing with this pandemic. And this, unfortunately, we have to learn how to live with this pandemic. Okay, this virus isn't going anywhere, and so life goes on. We have to continue to be smart and be informed and just do the best that we can with the tools given.
Myra, before Allison decides to cut us off, just let Myra speak, Allison.
Really quickly, I don't have any children. I have a lot of nieces and nephews, and just like everyone else stated, it is their individual choice. I think, you know, it takes a village to raise a child. So reach out to your village if you do have that, and definitely reach out to different support if needed, but definitely make the safest decision. So very individual based. That's all.
And I'm going to end with a quote from Mindy on the Facebook live chat, who said, "Facts. Kids are going to be kids when they behave differently in the presence of parents and guardians. Only the parent can decide what is deemed safe." And I think she's absolutely right. You parents or caregivers need to take control of the situation and decide what your kid can do, because every kid is not the same. I would like to ask that all of you who are in the Zoom chat or on my Facebook Live, can you please complete the Qualtrics survey that I've put into the chat so we can get feedback from all of you. It's completely anonymous and it won't take but a couple of minutes. In addition, I just want to say that we actually have a bonus session next week. Normally we do every other week, but resources for that, your legal rights. We have lawyer Curlin Flowers as well as social worker Tyra Busigo. So that's going to be great. And then, as I promised, in September, we're talking about financial health and literacy. We're going to have several successful small business owners from our communities on for that session on September 3rd. And September 17th, we're going to talk about voting. We're going to have some great folks here to talk about voting. For those of you who are registered to vote, make sure you get out to vote. Find out all the possibilities for voting. You don't just have to go to the poll. There are mail-in ballots. There's early voting in New York now. So make sure you look into that now, because we only have like 80 something days before that day comes for election day. And I would just like to say thank you to everyone on the panel. You all were phenomenal. I have to give a shout out to my sorors who are on this panel. Thank you, Soror Jean, Soror Renee, and Soror Nikki. And shout out to, of course, our soror. Thank you, Myra, Maya, great job tonight, and we'll see you guys again next week. Take care.
Thank you, Allison. Bye, everyone.
Good night.
Oh.